The amended version of the Violence Against Persons Prohibition VAPP law, which was recently assented to by the BAUCHI State Governor Bala Muhammad, is one of the giant efforts by the state government aimed at combating sexual and gender-based violence. Part of the law made provisions for taking care of the survivors of GBV.
Yes, there is a provision under the amended VAPP law that was signed into law yesterday by the governor, His Excellency, the governor of Bauchi State. And the provision provides for the right of survivors to free medical intervention, treatments, and services. So it's now mandatory for all hospitals to offer free services to survivors of GBV. So whether rape or any other forms of sexual and gender-based violence, the hospitals are mandated to provide quick and free medical services. And it's punishable under the law when any medical personnel or health service providers or doctor violates this provision. And the punishment for it is about 6 months imprisonment or a fine of 500,000 naira.
The question here becomes, does the law apply to both public and private healthcare facilities?
The law does not differentiate between public hospitals and private hospitals. So all hospitals are supposed to provide the services. But remember that the evidence that the courts use are evidence generated from government hospitals. So we should see it like it's government hospitals now, because if you want to actually use the evidence, you have to go to the government hospitals to get treatments and investigations.
Zuwaida Baba is a gender desk officer of the Bauchi State Ministry of Health. She says this is a welcome development as the state is striving to achieve universal health coverage.
With the signing of the VAPP law, I think I would say we are on the same page, because we have a lot of even international donors that are currently supporting the state in terms of health with provisions of equipment as well as commodities at facility level to ensure that our people have access health and get the necessary medical intervention they deserve.
The need for service providers at both public and private health facilities in the state to strictly adhere to this law has therefore been emphasized. Awal Hassan, VOA TV News, Bauchi.